Well, good morning, everyone. I'm King County Executive Dow Constantine. Welcome to the next step, the next big step in bringing housing to our neighbors who've been chronically homeless. We're here in Renton with our host, Mayor Armando Pavone, and the Renton City Council to share our next purchase in our Health Through Housing initiative, the regional solution for chronic homelessness. Health Through Housing is built on the opportunity that was really created by the pandemic, the opportunity to rethink our approach to permanent supportive housing for the chronically homeless. We know that when people have a place of their own, when they have solid ground underfoot, they can rest, they can feel safe, they can begin to heal, and they can begin to take command of their own lives again. I can go on about what's possible when people have a place of their own, but you don't have to take my word for it. The University of Washington studied our success last year and called this approach a total life changer. So we have the solution. A place of your own where instead of having to sleep with one eye open, being concerned about being attacked or having your things stolen, you can finally just sleep. But to construct new buildings to allow that to happen takes time, takes years. Time that we spend waiting for permits, time that we spend looking for sites, time where we have to worry about the variation, even things as simple as the cost of labor or the cost of lumber. We need to act and act right now. And that's just what we are doing. So last week, we closed on the sale of this hotel, this former extended stay hotel, and we're now working to get the building ready for our guests. That includes facilities improvements, lining up partnerships with providers, and working with our partners at the city to ensure we are doing the most good possible. We'll be able to open these doors and provide more than 100 guests the 24/7 on-site support that makes this program successful, giving them a chance to have that total life-changing fresh start. The units in this hotel are testament to the partnership that we have forged with Mayor Pavone and the City Council in the City of Renton. Working together, we are able to stand here today with a plan to move forward based in collaboration and in partnership and in action. Together, we will also be phasing out our emergency shelter, our emergency COVID shelter that we set up at the Red Lion Hotel just down the street. And we're going to be able to move those guests directly into other housing that we are also purchasing through the Health Through Housing initiative. And with our partnership, at least 15% of the units here at this extended stay hotel will be available to people who are experiencing homelessness right now, today, in Renton. And what's important to remember about chronic homelessness, it is not a Seattle problem. It is not a Renton problem. It is not just a King County problem either. It is about the cost of housing and about income inequality globally and nationally and here in our region. It is about the incredible economic growth that we have experienced here over the course of the last decade and the constrained housing market that's not able to keep up with that growth. It is about too many of our friends and neighbors who historically would have been able to hold on to a safe place to call home being pushed out of housing and into the streets. Chronic homelessness is a region-wide problem, and today we are here looking at a very sturdily built, concrete part of a regional solution. There's no way around it. Health Through Housing is a big deal. It is a game changer. It is an opportunity created by the pandemic. All of these hotels that we are working on purchasing were very highly occupied before the pandemic began. But because of the dip in the real estate market, the dip in visiting in our region, we were able to get in and begin negotiating with hotel owners to purchase their buildings and convert them from temporary stay space for visitors to permanent housing for people who are residents of our own region. It's a big deal because we're moving at a pace that was not possible before and at a scale that was not possible before, because our residents can't wait any longer. We have and we can have that future where every person in King County can thrive. But only if we're willing to meet these challenges, the challenges we face head on. Change is going to keep happening, and people are going to be impacted by that change. And if we are clear-eyed about it, then together we can buffer people against those impacts. We can help them get through that change. We can help everyone benefit from the kinds of changes that are happening in our region. We can keep pointing the finger towards someone else. It's Seattle's fault, it's the other city's fault, it's King County's fault, it's Amazon's fault. Or we can join hands and work together to help those who need it most. We are building the future of this region together with our partners here in Renton, and making this a future that lets every person in King County truly have the opportunity to live a full life and to thrive. And it's now my honor to introduce to you our partner in this effort, Armando Pavone, the Mayor of Renton.
All right. Thank you, Executive Constantine. I'd like to welcome everybody here today. I'd like to recognize the teams that were put together to make this possible, starting with the Renton City Council, and we have 4 of them here today. Angela Benedetti, Valerie O'Halloran, Kim Convan, and Ryan McGurban. The council was very supportive of this project. An effort like this is an all-hands-on-deck situation. Our human services, economic, and attorney teams all work together to create this solution. DESC, the owners of the Red Lion Investment Group, without the commitment and collaboration of these groups, this announcement would not be possible. Partnerships can be messy. I want to acknowledge the work from Leo Floor, Human Services Director at King County, and CAO Ed Van Bailey. Their weekly meetings and progress through those weekly meetings made this possible. We are confident that our partnership with King County and Executive Constantine and the creation of this model of supportive housing will provide a better opportunity to address the needs and some of the most vulnerable populations. Over the years, Renton has taken a unique approach to providing services in Renton, from partnering with the Center of Hope and Reach to convert an unused jail space into a women's day shelter, to partnering with the Renton Housing Authority, which provides low-income families with diverse populations. This is a good opportunity for us to announce the plan to create a new Department of Equity, Housing, and Human Services. This department will concentrate and build on the work of our social, racial, and economic justice, identified and addressing the root causes that affect those who experience homelessness and poverty. Homelessness has no boundaries. Renton recognizes the challenges and experienced by this region's unhoused and would like to serve as an example of a city who partners with local services, local governments, and the community to provide opportunities leading towards a solution. Thank you.
Questions? Okay, thank you, Mr. Mayor. And Mayor Pavone mentioned Leo Floor. He's the director of our Department of Community and Human Services, and he's really been, among many others on our team, key to helping make this happen. And I want to invite him to come closer because I anticipate you'll have some questions that he can best answer. Sorry, Leo. But we would be happy to take any questions you might have.
Sir, what makes this different from the Red Lion?
So the Red Lion, the question is what makes this different from the Red Lion? The Red Lion is an emergency shelter for moving people into a space where they can avoid contracting the coronavirus. And it was very successful in doing that. The folks who were there were previously in congregate shelters, mats on the floor shelters, where they came in for the night and then were ushered out in the morning. And that environment proved to be one in which the virus spread very quickly. We rented that hotel so that we could stop that from happening, and it stopped it quickly. But what we also found, and this is where I mentioned the University of Washington study, is that a lot of other things started to go well for the people who were then housed at the Red Lion. We had fewer behavioral health crises. People's physical ailments began to improve. People simply, and maybe most importantly, began to get rested. They had a full night's sleep, their own shower, we get cleaned up in the morning, and they began to be better able to accept and succeed with the other services we provide, with treatment, with job training, and so forth. That is why we had the university come in and study what was happening there, and they determined that yes, in fact, the simple difference between the overnight shelter and having a room of your own was quite literally like night and day. That was the key. We have been working to build permanent supportive housing, permanent affordable housing, and that is critical, but it takes years, and to build one of those units costs, I believe, nearly twice as much as what we are paying to have these units available immediately. So that is the key. It's less expensive, and it's much, much quicker, and for people who are living on the streets today, the difference of a few months, let alone a few years, is everything. So we're excited to be able to provide 100 units here, but ultimately many, many hundreds of units. It will be about 1,600 all in through this particular program. And I would be happy. Do you have anything to add to that, Leo?
Thank you, Executive Constantine. A couple of other things that make this different. One, this is housing and not shelter, as the executive said, so the best practices from single room shelter now available in permanent housing. The size of the facility is also different. The Renton Red Lion has about 230 people in it. And this facility will have no more than 115 people in it, so we'll have really good ratios of service providers and operators to the people who are living here. And then I think the last piece is that this is permanent partnership. We're standing here with our city partners. It took a long time to develop this partnership, and unlike the COVID shelter where we were acting knowing that hours could mean lives and disease transmission, we've been at this for months to build this partnership, arrive at this today. And so I think that's the other thing that's different about this opportunity is that we're starting it all together, and then we're going to be able to make this permanent as we go forward.
So let me ask you one more question. Is this a housing first approach? Is that what you would call this?
This is housing first, and we believe and we know that the most effective way to take care of any type of issue that a person is presenting is to first have them have a place where they can sleep, be well rested, have a place where they can keep their prescription medication, have a place where they can use the bathroom without signing up on a sheet and having to wait 30 minutes for that, like often happens in shelters. This is housing first because we know that that's what works.
Mr. Mayor, policy. Mr. Mayor, the city and the county clearly were not seeing eye to eye on this when it came to the Red Lion Lounge. What has changed from your perspective to make this happen?
Well, I think what both what Dow and Leo were saying, it's the difference between sheltering and housing. It's the ratios. You know, when it was an emergency situation, but there was a lot of changes that needed to take place, you know, to create the services that were needed in that location. It was, it's just a different scenario. I think you can see by the location, this is perfect for this kind of a housing type of situation.
Do you feel like you and the city council are satisfied with this solution?
We believe it's definitely the right direction. You know, having individuals in this facility so that the services can be provided is a lot easier than trying to meet folks out in the streets. So I think that their idea of actually having folks in housing and providing services is critical.
policy question, Sylvia, for now. Just, you talked about housing, health through housing. People are equating on a concurrent path there, and you have the homeless authority developing things. What's the future of hotels like this that the county's going to be purchasing in the future, maybe even what happened in Queen Anne, with the homeless authority? Will everything be handed over to them in terms of controlling it? Because you said 15% of the people from Renton could be placed from here from Renton, which is more of a shelter aspect versus not housing. So is the homeless authority going to take over these hotels in your future?
So first, the question is the interplay between this effort and the Regional Homelessness Authority. The folks who would be placed from Renton and South King County would be going from chronic homelessness to being housed in this. This is not shelter for them. This is a one-way ticket out of homelessness. But the Homelessness Authority is really about the emergency services for the people who are on the street today. And that was an attempt to consolidate Seattle and King County's different programs and to bring in the other cities and people with lived experience to focus on what's going on with the folks who are homeless tonight. This is about people who are going to be formerly homeless. We are moving people out of homelessness with the services to keep them ever from going backward into homelessness. The overlap there is the referral process for people coming out of that emergency situation, coming out of chronic homelessness into housing. And I hate to keep making Leo run up here, but he understands the referral process a lot better than I do. Would you like to illuminate that at all, or we got it? Okay, good. Others?
So it's step two then, to simplify.
Yeah, this is outside of the Regional Homelessness Authority are the housing systems and the behavioral health systems. Those apply to people who are currently homeless, but also to a lot of other folks. And we continue to run, manage, and build those. This is an exciting initiative in housing for people who've been chronically homeless, made possible by the very crises through which we have just passed. And this is kind of an example of us striking while the iron's hot. I mean, Leo's been out scurrying around with our real estate folks, looking at hotels all over the county, meeting with mayors and city councils and staffs, trying to identify where there are opportunities like this place, where in very short order we can get many people out of the streets, out of the parks, out from under the overpasses, and into a place of their own with the services to help them reclaim their lives.
Is this essentially permanent housing, or can they move on from here? Because clearly, an extended stay America was always meant to be transitional, even for people staying here in a hotel.
So this is intended to be a place where people can be housed and not be sheltered. This is housing. But we intend for this to be a first stop. It is an opportunity for people to get their lives back, begin taking on the barriers that have been holding them back, and move forward. And for everyone who has the ability, and we think it is the majority of people who are out there in the streets, the ability to reclaim some self-sufficiency, to begin to earn a living again, to be able to stand on their own 2 feet. We are going to do everything to help them do that so they can move on from here. And there will be some people who need permanent supportive housing, whose challenges are so deep that they're going to need a safe, dignified place with the appropriate services for their particular challenge, maybe for the rest of their lives, and we will find the right place for them. We expect the population here to change over time. We do not expect the same 100 or 115 people to be here indefinitely. But the first thing to do is to get them centered, rested, and ready to accept the services that will help them move on from here to the next step in the process.
When can we expect the first residents?
Do you want to speak to when we can have move-in here?
So we expect to have the first residents moving in here this summer, late summer or the fall at the latest. A couple of things that we're working through. First, we're going to be working with our city partners to select the operator. We've got a qualified pool of operators, but we have to make the formal selection, and we'll be doing that in partnership with the city of Renton. Second, as we all know, providers out there who do this work are thinly staffed right now. So the provider will have to actually hire the staff who will be able to come into the facility and work. And then, as the executive said, we have to go out through outreach and identify the people who live here. So all of that and a little bit of a permitting process happening at the same time, and we expect that we'll have the first residents in this summer, this fall at the latest.
What's going to happen to the Econo Lodge in Kent? Is it going to transition as well?
So the question was, what's going to happen to the Econo Lodge at Kent? I think the best way to think about this is unrelated to the Econo Lodge at Kent. So the Econo Lodge at Kent was one of three hotels that we originally leased or purchased. The county did purchase the Econo Lodge at Kent. We're in a close conversation with the city of Kent, but right now that facility is ready to serve as an isolation and quarantine facility if necessary. As things are going in isolation and quarantine, we've got relatively low numbers right now, and we hope not to have to deploy it, but we're keeping that in reserve through the end of this year in case we have some circumstance change where we have to bring people inside and keep them safe. This pandemic's not over yet.
So you'll remember the distinction. So the Renton Hotel was to de-intensify shelter. The Kent facility was isolation and quarantine for people so that they were not infecting others, which might have been folks who had family members in the home who were vulnerable, or might have been people who didn't have a home to stay in. We had a facility in Kent, one in Issaquah, one in North Seattle, one we did not use in the Top Hat neighborhood near White Center. And because of the Delta variant and the uncertainty about the future of this, we need to keep some space on reserve in case we have another upsurge in infections in our region. Remember, we've crossed the 70% threshold for adults having been vaccinated, and soon it'll be 70% of those 12 and over. But that means some 30% of folks have not been fully vaccinated, and there is significant vulnerability out there still. So our public health folks aren't here today, but on their behalf, I will say we have to stay on guard.
You mentioned the phasing out of the Red Lion and covers about 100 plus different or more people than this can fit. Can you assure that nobody's going to be put on the street?
That's right.
What's the process of?
That's right. So the question is about the Renton Red Lion. So that is a substitute for shelter. People are now going to move from that shelter substitute into housing. It will be housing like this. It won't be this housing necessarily, but we are going to buy, I think 2 hotels will be required to accommodate the people who are in the Red Lion. No one will be put out in the street. Everyone will have the same kind of arrangement we're going to have here, with a place of their own and the ability to begin moving forward with their lives. I would hasten to add that not everyone is a candidate for this kind of multifamily setting. As I go out and visit the homeless encampments with providers, they point out that most of the people can live in an apartment type setting and be good neighbors, but there are a few folks whose behavioral health challenges are such that they need a different arrangement. And we need to work with our providers to make sure that those folks get into the right arrangement. Folks are screened. The providers work with people as they are homeless, as they're in the encampments, to understand what their challenges are. And really, anyone who's unable to live in this kind of setting with others will not be moved in, and they will be helped in different ways, but they won't be moved in this kind of setting. This is going to be a community, and it is an opportunity for people to live, as we all have at some point in our lives, in a multifamily setting with neighbors, and begin to just live a normal life again. And that's what's so exciting about it, is how sort of mundane it is to get out of the streets and get on to a situation where you're just greeting your neighbor in the hall, having a seat and having a conversation here in the lobby, and thinking about what's next in life. That's what I found when I went to the hotel on Lower Queen Anne, or Uptown, sorry, that, there wasn't anything extraordinary going on. It was just normal people sitting down with each other and having conversations about where they've been and where they aspire to go next, and really thinking about a future for themselves. That's what's so exciting.
One quick one, Gal. Dorm-style, non-congregate shelters, are those days over, and will the county ever fund one again?
The question is about dormitory-style congregate shelters. I think that, we've really realized that that is not the best approach. It had been providing mats on the floor type shelter, and then it was the leap to a purpose-built supportive housing or other unit, and that was a big leap, and there was not enough supply coming online to get folks out of there. There will be circumstances in which overnight shelters are still appropriate. We're maintaining one at 4th and Jefferson, the space to get people in out of harsh weather, etc. But it is not going to be the central or preferred, the go-to approach anymore. We are moving to this kind of an approach. And a couple months ago, I announced an intermediate step that is much more than the congregate shelter, and that is the 24-hour enhanced shelter, where you have your own space, on-site restrooms, on-site services, on-site security. It was much more similar to this than the situation where you come in and then get kicked out at 7 in the morning with all of your stuff. And we think that that is going to be, for folks for whom we don't yet have their own room with a key, a lock on the door, it's going to be a much better option than sleeping in your tent or in your sleeping bag under the bridge. Folks, thank you so much for being here today. Are people going to get a chance to have a look? I got to tell you, this is a very well set up place for this purpose. It has, rooms with kitchens. It has a laundry facility. It has places like this lobby for people to congregate. It is exactly what we are looking for. And, this is maybe the best scenario, this extended stay model. But in some of the other hotels, we will also have the ability to either buy or create small kitchens in each unit. And it's going to be, this is a chance for us to really turn the tide on homelessness. I'm very excited about it. Thank you so much for being here, and have a look. Thank you. That was very good. Thank you. Thank you so much.